Welcome to the Chief Healthcare Officer Podcast's another episode. It's a pleasure meeting with you all, and thanks for your time following the podcast show. It's my pleasure having my guests from my network and then meeting with amazing people and then discussing healthcare leadership issues. So in each episode, we try to touch to another important subject, emerging subjects, and it's my pleasure discussing and covering these topics together. Today, we have another exceptional guest, Dr. Tom O'Callaghan. He's an entrepreneur, a doctor, a founder, and at the moment CEO of Medical Education Founders Investment Fund. And he is also a practicing family physician, and he has very rich background on medical education. So, Dr. Tom, thanks for joining me today.
Delighted to talk to you, Fatih, and delighted to join you from Tipperary in Ireland. I presume you're in Doha.
Yes, I am, and thanks for joining me. So before we get started, would you mind to just share a little bit from your rich background, so then my listeners and our followers will know you better?
Yeah, so I'm 58 years old, qualified, grew up in the south of Ireland, in Tipperary, and my father was a family doctor, and I joined him and followed into medicine. Qualified in the College of Surgeons in 1991, and then did vocational training in general practice. Then worked a bit with the Irish government supporting primary care in different parts of the world and working on primary care centres, and eventually set up iheed, which was an online medical education company based out of Ireland, which we grew over the past 10 years to about 5,000 annual postgraduate enrolments across 130 countries. With universities like University of Warwick, Royal College of Physicians, etc., educating doctors and nurses around the world to get a postgraduate education without having to take time out of the health workforce or take time out of busy clinical practice. And I sold that business to Cambridge Education Group last October, and I'm now just beginning a new phase of developing a new entity, the Founders Medical Education Investment Fund based out of Ireland.
Amazing. I want to know more about Medical Education Founders Investment Fund. So are you going to have new ventures on that one, or some mergers we will hear? So what is it up to?
Yeah, so basically on my journey as a medical education founder, obviously as a physician, my motivations were really to help colleagues around the world get access to postgraduate education in a way that suited their busy lives, and found that the traditional models of people taking time out of the workforce and having to travel abroad, take time away from their family, their busy clinical practice, and the challenges that the health workforce had in replacing them, that sort of was an interesting journey. But along that journey, I met a lot of other medical founders who were building similar businesses in medical education and health workforce staffing around the world. Many of them, I suppose, social entrepreneurs who were really motivated by the impact they were going to have in the global health workforce. And many of those founders were struggling in different ways, but particularly struggling to get access to investment funding, and particularly funding that I suppose was aligned with their ambition and with their expectations. A lot of those companies approached me and sort of said, look, we'd like to learn from your experience, but we'd also like to get access to the sales and marketing expertise, the product development expertise, access to universities, access to medical regulators, to new markets, access to healthcare organizations like Disparities, and I suppose access to staff and people who've done this before in different businesses. And really that's the ambition here, is to work with long-term strategic capital. And I suppose I've had the good fortune to meet a lot of those investors along the way who share that ambition and are interested in supporting this important and critical work around the world. And to work with those and with those businesses, bring them together and build something innovative out of Ireland that can have an impact around the world. And just to finish on that, we're kind of at a stage where we've probably got 10 or 15 different early and growth stage medical education companies who are in discussions with us, the founders and the management teams. And on the investor side, we've similar discussions ongoing.
Excellent. So you're now mentoring the medical education companies, how to grow, how to thrive, and then have a better network all over the world. Are these companies you're in touch, are they from different countries or mainly UK and then Ireland?
Yeah, so they're a mixture of countries. Obviously the biggest impact our work had, about a third of the students when I was leading iheed were in Europe, about a third in the Middle East, and about a third in the rest of the world. And that was a really broad spread, but predominantly down into Asia and into Africa. We did very little in the US. We did a good bit in Australia and in the UK, but very little in the US market. But this work is taking me more into, I suppose, the US market, which obviously, as you know, is a very big market. And as somebody like yourself who spent a lot of time working with large healthcare groups around the world, there is this kind of, I suppose, move of healthcare workers and staffing and education from parts of Asia into the Middle East, into those developing economies, and then on into markets like the US, Canada, and the UK. And there's huge opportunities and synergies by having access to those markets, but also having companies that are working in different markets, because in the end of the day, many of them are trying to solve the same problems, and there's overlap either in their client base, in their products, in their services, or in the expertise within the teams. So it's really kind of to harness that kind of collection of knowledge and expertise and put it to its best use.
It's very valuable assistance and service, actually, what you're going to provide, because we know this very well. Supplies is not enough in the world, and there's a huge demand for medical education. And also, I mean, we know this very well. By 2030, the real crisis will start for the healthcare professional shortage issue, and WHO keeps releasing reports. And we know this very well. By that time, finding a nurse will be very difficult. It is very difficult at the moment, but it will be more difficult at that time. Reaching to a doctor will be very difficult. That's why I think we need to start working on it. And you're on the very right direction, I believe. I mean, today it is 2025. In 5 years, if you can help people to open more medical education facilities, I think this will be a wonderful service to the whole globe, the whole humanity.
Yeah, well, one of the big challenges have, like in the end of the day, you know, it's a reasonable expectation of any community or any individual or families or countries around the world that they have access to basic healthcare facilities and education. And, you know, there are many challenges in undergraduate medical education, in postgraduate and residency and fellowship, not just on the medical side, but as we said, right across the nursing and ancillary healthcare side as well. And as you say, some of the statistics are really damning in terms of both the size of the challenge and the impact we've been able to have. So, you know, what's pretty extraordinary is that a small group out of Ireland in iheed that over a 10-year period, growing to 5,000 postgraduate master's students on programs, was actually bigger than most UK universities' output as a medical school.
Indeed.
So you know,
Indeed. Yeah. I mean, it was an amazing success story.
It was, and you know, it continues with Rebecca and the team. But the challenge I think that we face is that, you know, it's a complex and difficult landscape. Forming public-private partnerships can be challenging. There's a big gap between the needs of healthcare organizations, particularly what you're working under tight margins, extreme pressure, escalating costs with huge staff shortages, and universities and postgraduate training bodies who work to different timelines and to different governance structures. So it's kind of marrying those two. And then obviously the challenge of funding, which is, you know, a huge issue, both at an individual student level and at an institutional level. And what's exciting is to see some of these new models that are emerging in terms of really organizations, particularly in the US market, and I think more and more in the Middle East and in Europe, starting to take control of their pipeline and saying, well, look, if we're going to have nurses for the future, we need to invest in long-term strategic partnerships where we're able to build that pipeline of specific qualified individuals, help them get access to funding to study and become part of the profession, help them to come and join our organization. And over a specific period, we'll repay the loans that they took to take that education and training program.
I think it's a very wise approach if they have started planning on this, because we know this very well. I mean, in Dubai, when I was running the hospital, same thing in Saudi, same thing here in Doha. I see many organizations from Western countries, they are approaching to the talent, and the turnover in the nursing teams, when you analyze them, you find a very big category of people moving to the Western countries. And today, We know that many, systems in UK, US, they have category in their website tracking and then encouraging actually the talent from the Middle East, from Asia, to submit their documents, and then they're just waiting for them to join these countries. Definitely, it has pros and cons, but especially for young talent, I think they see this as an opportunity, and we are seeing this. So creating the school or making some additional investment for the medical education will be an amazing thing. So before we go to the corporate side, if we look at the general globe, and if we want to understand better current landscape for the medical education globally, can we just start from this, Dr. Tom? How is the medical education today globally? And then once we put the current status on the canvas, then we can build up the discussion on top of that.
Yeah, so you could say it's a huge question. And it varies regionally. There's a huge disparity in terms of the rollout of medical education, particularly undergrad medical education in different geographies. Obviously, some of the Western states like the US and Canada, Australia, UK, Ireland, have very evolved systems that have been there for a long time. Some of the newer geographies, or some of, particularly the Middle East, Asia, and parts of Africa, they're at different stages of evolution. There's a big difference between the public and the private system. There's obviously a limited number of private medical schools in the world, and there are many challenges in terms of regulatory hurdles. And in fact, one of the biggest challenges is funding models in opening these schools. And then I think the big challenge in terms of running these schools is quality and reaching those quality standards. So, when I visit around the world, you see huge differences in different parts of the world. I could give you tons of examples on the undergraduate side, from the Caribbean right to the US, where there, haven't been very many new medical schools opened over the past, 30, 40 years, to places like Saudi Arabia, where there have been many medical schools opened. Malaysia is another example, and other parts of Asia, where there have been many new medical schools opened, and the challenges around that. So it's very varied. What I would say is that on the investment side, there's huge appetite to invest in medical education, because people see that there's always going to be a demand for qualified doctors in the world. So from a private investment side, there's huge capital available for these, but the challenges are that they can be very slow, very expensive, and very challenging projects. And then the net result is that very few happen. And then on the public side, I think a lot of the existing medical schools have significantly scaled their numbers. And we'd see it here in Ireland, where a lot of the medical schools have doubled in terms of their intakes over the past 10 or 15 years. But the big challenge they have is, and all of these medical schools have, not just here, but we see it in the UK and Australia and US, Canada, etc., is the availability of clinical placements for further students. So while they might have an ambition to take on more students, their availability of clinical placements is a real challenge. And it's interesting to see some really exciting companies coming through now that are, I suppose, providing virtual clinical placement solutions to help scale access to clinical placements for medical schools and for nursing colleges and other ancillary healthcare professional groups.
I think they have to get into the digital solutions, because we're talking about the next generation, young generation, and going to the medical school undergraduate is not an easy job. And some of the young people, they find this as a challenging path for them. So to attract them, I think we have to use any kind of different solutions, making the school attractive and then easy for them. And I totally agree with you for the disparity between the different countries. I hire healthcare professionals from all around the world, and definitely you see the differences between the school, because they're all coming from different school, different culture, different kind of education. Some of them are very strong. Some of them, they still need some additional support, even though they had some work experience. You see this difference between the countries. Some of them, they have seen too many patients. They created their own way of, management. Some of them, they have not seen much. So I definitely agree with you. But working on this globally, I think, is a big need, because after COVID, we all have seen the importance of the healthcare professional quantity, because some of the countries at the time of COVID, they couldn't even have any nurses. I remember some of the planes, they were just flying between the countries and transferring nurses, 300 nurses, 500 nurses at one time. So then they were just trying to close the gap. So since the importance is there, since the private equity support is there, so then for the, medical education, if we have the medical education facility and the others, what are the biggest challenges? You mentioned the funding, but then I just want to understand more about the biggest challenges actually facing the medical education today.
Yeah, so I think if you look at, for example, funding is probably one of the bigger ones, but if you look at the big challenge is really the disparity between universities and healthcare providers. So, for example, I know some healthcare providers have built medical schools of their own, and that has been successful from time to time. And then in other occasions, large healthcare providers, I know some of them in Asia, who built medical schools and nursing schools and then divested themselves of it because it's ultimately a different business model and it's a different model to their healthcare delivery model. So I think my firm belief is that what's really successful are strong strategic partnerships built on trust and a shared ambition and a shared vision. And that was the success of our business in iheed, was really having that really long-term strategic partnership where you really built a trust and everybody knew what we were getting into together. And we had that at the very core of who we were. And I think that's really the success. And that's one of the areas where I think the investment fund has opportunities, because I think there is, would I say, some skepticism about some capital and some private equity groups. So I think the opportunity to come with long-term strategic capital, to build long-term strategic partnerships, public-private partnerships, often with well-funded public institutions who may not be willing to get into a relationship with the wrong type of partner, but if they have a shared ambition and trust and a track record, there's more of a willingness to do what's right and to get out there and build to the opportunities there to provide access for healthcare systems to educate a whole new generation of doctors and nurses.
Sure. In my previous hospital group, we were operating a medical education arm, and it was a wonderful thing. Every year I was getting guaranteed minimum 30 fresh graduate nurses. And on top of that, we were also having the physician graduate. So for, I think, healthcare system, it is a great privilege having this kind of addition. But what I have seen over there, setting the right curriculum was not easy. And that's why our teams, they were trying to get the support from UK, from US, and then they were trying to also get these kind of curriculum certified and approved by the local authorities. So then they were trying to set the bar in the right way, so then we can offer the right services. And on top of that, we have seen a kind of actually need for an affiliation. So then our teams have worked on the affiliation. I think this helped our college to have a better positioning over there. So this was not an easy job. And integration-wise, our teams, and then we had to work on this. And the last thing is about the integration between the education facility and then hospital staff, because hospital staff in a private hospital, they're already busy. And we also started the residency programs. We were having 26 residency programs. So I think integration over there is very important. We need to change the mindset of the healthcare operators. The doctors and the nurses who are in the service. We need to change their mindset for the academic care. And at the same time, we need to also get the alignment from the education side for the daily needs and then better integration with the teams. So it was not an easy job, definitely, but it was a great privilege, and it was also having a positioning investment. When the patients, they see your hospital as a teaching hospital, their look to your hospital will be different, and they will know that you will have the best talent, and you're teaching the students, you're teaching residents. So I believe there are many benefits beside these challenges if in case you start such attached adjacent medical education activity in your company.
Yeah, couldn't agree with you more. All of those challenges and opportunities you outlined. Retention is the new recruitment, so if you think about it, that attracting talent to your organization can be very challenging. As you said, if you're an academic health center, it becomes even better. And if people are allowed and want to be involved in teaching, it's even more exciting. If they have those career paths, that improves their longevity and their loyalty to the organization. And, it was a huge part of what we did in iheed was you were providing postgraduate programs which allow people to get into a stream of leadership or education or management or another area of their career. So it just, either specialization in a particular subspecialty or getting into management or into research or education, those various tracks. So I think, if you think of the cost of recruiting staff and, 20% of their first year's salary for a medic, for example, and if you think of investing that money in their postgraduate education and improving their likelihood of not being one of those 40% of people who leave your organization and move on. If you can do that, then you really put yourself into a very strong position to continue to grow your organization. And I think that's really the opportunity for
Definitely.
yeah. And as you said, curriculums that align with the needs of the organization.
And also, I remember when I was meeting with some investors from private equity or IPOs and the others, they were asking the question, hey guys, I mean, you're in the medical education. Do you really have a good EBITDA from the education? Because many, hardcore healthcare operators, they don't believe that education can make money. And at the end of the day, I don't want to also make it sounding as if it is just a charity operation or the corporate social responsibility. No, it makes money. And I believe, with it was also having a high EBITDA in our operations. So I believe in Medical Education Founders Investment Fund, you will be also, the advocate for further investment and having, new medical education companies, and then you will be attracting them globally, right?
Yeah, so it's impact investing, right? So it's not a traditional private equity play where you're taking a relatively short-term view. This is really taking a long-term strategic view with particular family funds and long-term strategic investors who have a belief in this space and want to do well by doing good, and who believe that, rather than investing in other areas, they'd like to invest in impacting medical education globally. And that's, I think, very virtuous. And I think that's a great opportunity for us to take existing successful early stage companies that are having that kind of impact and really help them to scale their impact and to have a bigger global reach, and also to transform the sector, to really challenge the sector and really come up with innovative models. And many of those companies, I could give loads of examples around virtual clinical placements, around VR and simulation, obviously around hub and spoke models where you get these public-private partnerships to help scale nursing and healthcare professional education programs, obviously the online and blended education programs, and then obviously different tools and content providers. So there's loads of opportunities. And I suppose my strong belief is that if you have a portfolio of these companies who share their knowledge, expertise, and have access to the networks and to all of those tools, it will help have a bigger impact faster. And that's really, I suppose, what I see. I'm 58 now, and over the next 6 or 7 years, this is what I'd like to do, is to really push on and have the biggest impact I can and work with a lot of the amazing young people that I've met in these companies who are really driven and they have many choices. They could be doing other things with their lives, but this is what they choose to do because they know it's the right thing to do, and it's to support them in the best way we can.
No, I'm sure they will appreciate this a lot, because I remember my days when I was asked to invest in the simulation center. It was not that easy decision. Find the right choice and then look at the models and then review the outcome. Then based on this, check with our teaching parties and then the colleagues. So then we will, have the right thing in hand together with the right curriculum. And also you have to build another kind of, partitions, and you have to manage the MEP. It was not that easy, but I'm sure your consultancy and then your network will be very helpful. So from this point, I want to move to the feature of medical education. I was in Arab Health, and I have seen some education technologies over there. Not under the name of medical education only, but again, for continuous medical education, they were recommending for hospitals to implement such things. But I believe it starts from the medical education facilities, because I remember, I mean, we were also discussing with our college management earlier to even bring an EMR education to the medical students, just to prepare them how to use the EMR in future, because we were not told, I mean, when I was in the medical faculty at that time, how to take the doctor notes, how to use the technology. So I think we are in a new era from this approach. So how do you see the future of medical education from this point?
Yeah, so I think, as you said, more tailored curriculum to meet the specific needs of the organization. Obviously, implementing those changes in terms of curriculum around the use of technology like telemedicine and AI and all of these tools that are coming on board. And you said it earlier on in the podcast, younger generations' expectations of how they're going to learn and how technology is going to be used in their daily life is very different. But more importantly, the rate at which AI is impacting all of our lives is pretty extraordinary, I mean, I think on the education side, there's going to be a huge personalization of learning, tailoring learning experiences to meet the individual's need, tracking that individual's progress, helping them to improve their educational outcomes, coming back and remediating them all the time, helping them to learn better and better and better, particularly where there's hands-on experience involved. And again, you mentioned it earlier on, but interprofessional learning, where ultimately, if you're supposed to be part of a team and function as part of a multidisciplinary team in a hospital, but you don't learn as an interprofessional group, it's very difficult unless you learn together to practice together. So helping to use those kind of tools to enhance the education experiences of people. And then we're obviously going to see AI affecting all of these tools you would have seen at Arab Health, and we see them now at all these healthcare events around cobots, AI assistants, scribing of medical records into the EMR, and then things like VR and AR to help practice essential skills in a risk-free environment, helping to care for patients with complex interventions, but to do it in a way that it's risk-free and you're doing it using the latest technologies. And often it's as simple as practicing very complex conflict resolution or challenging conversations, but being able to do that in a VR and AR way. And clearly, this is changing very rapidly. Some of the hardware is expensive. I often think of, obviously I spent 10 years traveling around the world and meeting healthcare systems and meeting medical universities. And one of the things that really struck me was just how much money was invested and wasted in high resolution simulation labs, which were sitting idle and never being used. So, high fidelity, expensive, enormously expensive equipment. Whereas now, with the reduction in cost of headsets, etc., we're getting to a point where there really are scalable solutions and scalable businesses in this space that can really have impact. So I think that from that point of view, it's very exciting.
I know. I mean, I made huge investment even in the conference rooms earlier. The conference room setup, everything. We bought different kind of internet setups before the COVID. And when the COVID came, immediately, even the Skype became something better. It became, they turned it into Teams, and then Zoom became something very easy. Even the children now, they're, I mean, having their games over the Zooms and then the other. So I think we also expect huge changes in 10 years' time. And we need to prepare our young people for the practice which they're going to have 10 years later. And in order to have them ready, definitely we need to make investment in all these things. So the last point, I just want to touch to the leadership in healthcare, because in the Chief Healthcare Officer podcast show, we always try to touch to the leadership and then to mobilize our teams and then to also create better engagement. So when it comes to the, I mean, shaping the future of education or the workforce training, I want to also hear your advice on that one. So what is your recommendations to the healthcare leaders? How can they shape the medical education, and then how can they make their workforce ready with all these educations to offer better services to their patients?
Well, it's a funny thing. I saw Simon Sinek had a quote there a couple of weeks ago, and I love you follow him, but I thought it was a great point. He said that Martin Luther King said, "I have a dream, not I have a plan." And I thought it was brilliant, because in the end of the day, this is all about people. And all of us want to make a difference in the world. We all want to have the best impact we can. and particularly in healthcare where we're touching people's lives and we're involved in some of the most difficult and challenging and sensitive times. We think of all our own personal families and our communities, and we want to do the very best we can do. So I think to me, it's all about treating the people who work with you with compassion and with care and consideration and respect, and allowing them to blossom and allowing them to give their very best and supporting them to do that. So my firm belief is that people are capable of incredible things. I've seen it, so many times in my life, in my clinical practice, but also in my journey, in my medical education journey. And it just, time and time again, I'm just amazed at the ability of people to do incredible things if you just empower them and support them and nurture them, and they know you've got their back. If people know you've got their back and that if anything goes wrong, you're there to support them, I think that'd be my number one tip.
Brilliant. Thanks so much. It was a great advice, and I'm sure the listeners of this podcast and then the healthcare professionals, healthcare leaders will definitely apply them in their daily practice. So thanks for this time, Dr. Tom. I really appreciate sharing all these insights with us. And then I encourage my listeners actually to follow you on LinkedIn, and you're sharing all the updates about medical education and how medical education can get better with your international insights and then visits. So do you have any last thoughts you want to share before we close?
No, just, it's always been such a pleasure to meet with you, Fatih, and to see the amazing work you've done. You're somebody I admire and respect. You're a family doctor by training yourself, obviously from Turkey originally, and have been on that journey and, worked across Saudi, Qatar and UAE, where I've met you over many years in very different settings, in very complex, large organizations, always smiling, always putting the people first, always showing respect to your staff. I suppose I'd like you to continue that great work and to continue the great support you provide to all the people around you. So thanks a million. My pleasure to talk to you today.
Thank you so much. Thank you so much for your great words. I know that, you're working also as a physician for a very well-known technology brand in the world, but I didn't want to touch this part. Maybe in another episode, you can share with us the coming technology things, what you discuss with your patients from this company. But I'm sure it will be also an amazing subject to cover in future.
Great. Look forward to that.
Thanks everyone listening this episode. We will definitely continue exploring innovation in healthcare with another exciting guest in another episodes. Please continue to follow, and thanks for listening us today.